Hi everyone. So in this video we will be studying orthopedic images and this video will be the first part of this section. So the first image shown here is of Tillock's Chaput fracture. Tillock's Chaput fracture is fracture of tibial attachment of AITFL, anteroinferior tibiofibular ligament. So Tillock's is starting from T and this fracture is on the tibial region. On the tibial region, tibia is also from T and Tillock's is also from T. So this way we will remember it. Okay, then the next one is Wagstaff-Leaford fracture. Wagstaff-Leaford fracture, the medial portion of the fibula is avulsed at the insertion of the tibiofibular ligament. In the Wagstaff-Leaford, it is not tibia which is injured, it is in the region of fibula. Okay, it is in the region of fibula while Tillock's was in the region of tibia. Then is Massonavy fracture. Massonavy fracture is fracture of proximal fibula with the syndesmotic rupture. The proximal fibula will be disrupted and the syndesmosis. See here the proximal fibula shown here, it is disrupted and it leads in syndesmotic disruption. Okay, Massonavy, Wagstaff-Leaford and Tillock's Chaput fracture. 3 we have done. Then is Volkmann's fracture. Volkmann's fracture is tibial attachment of posterior-inferior tibiofibular ligament. It is in the region of posterior region of the tibia. See, it is shown here. Okay, so we've done 4 main fracture: Volkmann, Tillock's, and Massonavy and Wagstaff-Leaford fracture. Then the next slide showing here is kyphosis. Kyphosis can be angular or round. In the angular, if only one vertebra is involved, then it is called knuckle. And if 2 or 3 vertebrae are involved, then it is called gibbous. And it is called round when more than 3 vertebrae are involved. So basically it occurs in the spinal tuberculosis. How we will remember that in the knuckle one vertebra is involved? See, we say to the hands knuckles. Okay, on the hands, fingers, we have knuckles. So for one finger, there is one knuckle. So that way we will remember. And the other one will be gibbous, 2 or 3 vertebra where it is involved. Then the next is staging of neural deficit. Staging of neural deficit, also known as Tully staging, is basically done in case of tuberculosis, spinal tuberculosis, and the stages are as follows. Stage 1 is unaware of the neural deficit. In the stage 1, patient will be unaware. Then the stage 2 is partial motor deficit. Okay, partial motor deficit. Then is stage 3 is motor plus partial sensory. Here motor is fully gone but sensory is partially present. Then in stage 4 motor plus sensory fully gone. And in stage 5 there will be bladder or bowel involvement and spasms, flaccid tetraplegia, paraplegia. सो हाउ वी विल रिमेंबर, स्टेज 1 में पेशेंट को पता ही नहीं है कि उससे न्यूरल डेफिशिएट है, वो तो क्लिनिशियन डिटेक्ट कर रहे हैं. ठीक है, स्टेज 2 में क्या है, मोटर डेफिसिट है बट क्या है, पार्शियल. स्टेज 3 में मोटर प्लस सेंसरी, मोटर तो फुली चला गया और सेंसरी पार्शियली बाकी है. फिर आ गया स्टेज 4. स्टेज 4 मीन्स ऑल गोन. ओके, so motor plus sensory full gone. And stage 5 is 5 bladder and bowel involvement is there. Then the next image is of Wartenberg sign. Wartenberg sign is ulnar nerve injury and abduction of the fifth finger caused by unopposed action of ulnar insertion of the extensor digiti quinti, radial innervated muscle. So what is Wartenberg sign? Wartenberg sign is abduction. Means बाकी फिंगर से लिटिल फिंगर दूर चली गई. Okay, and why it is due to ulnar nerve injury? Due to the unopposed action of the ulnar insertion of the extensor digiti quinti. Extensor digiti quinti की मतलब अल्नर इंसर्शन है जो वो ओवर एक्ट कर रही है, तभी ये फिंगर अबडक्ट हो रही है। और किससे इनर्वेट हो रही है वो? रेडियल नर्व से। सो दैट इज वॉटनबर्ग साइन। Then next we have the Salter's classification. So in the Salter classification, we have type 1 to type 5. Okay, and the type 6 was given separately, that we will discuss at end. So this is normal. Then in type 1 S for straight across the epiphysis. Okay, it is seen in SCFE. SCFE is slipped capital femoral epiphysis. Then A for above means fracture is above the epiphysis and it is most common. The triangular metaphyseal fragment is there. Here the triangular metaphyseal fragment. This triangular fragment will be there. It is known as Thurston Holland sign and it is seen in supracondylar humerus fracture. सुप्राकंडाइलर ह्यूमरस फ्रैक्चर में भी क्या होता है? एपिफाइसिस के ऊपर मींस कंडाइल्स के रीजन के ऊपर होता है फ्रैक्चर. सो इट इज मोस्ट कॉमन एंड टाइप 2 इज देयर. Then is type 3. Type 3 is lower or below the epiphysis and it is seen in the case of lower end tibia. Lower end tibia like in the ankle fractures. Okay, then is type 4. Type 4 is to or through the epiphysis means the fracture line is passing through the epiphysis. In the first it was straight across the epiphysis. And type 4 is second most common and it is known as fracture of necessity. Fracture of necessity means कि इस फ्रैक्चर को हमें रिड्यूस करना ही पड़ेगा, ट्रीट करना ही पड़ेगा, कॉन्जर्वेटिव नहीं हो सकता. And this is the case of lateral condyle humerus fracture. In the case of lateral condyle humerus fracture. Then is from the ER. From the ER we have type 5, erasure of the growth plate or crushing of the growth plate means growth plate है जो वो fully damage हो गई है. It is least common and it is due to fall from the height. It is due to fall from the height. So S for straight across, A for above, L for below, T for through the epiphysis, ER erasure of the epiphysis. Most common type 2, second most common type 4, least common type 5. Okay. And the type 6 injury, type 6 is injury to the perichondrial ring of Lacroix. Remember as such, injury to the perichondrial ring of Lacroix. So that was about the Salter's classification. Then next image shown is of diabetic chiroarthropathy. In the diabetic chiroarthropathy, we have prayer sign. Prayer sign is basically inability to oppose the palmar surfaces of hands and fingers with the wrist dorsiflexed. Means क्या है? हम palmar surfaces हैं जो हमारे दोनों hands के उनको अपोज नहीं कर पा रहे, बिल्कुल साथ नहीं लगा पा रहे. एंड फिंगर्स जब हमने क्या किया रिस्ट डॉर्सीफ्लेक्स्ड है. दिस इज नोन एज प्रेयर साइन. इट इज सीन इन डायबिटिक्स. Then is tabletop sign. Inability to make contact with the entire surface of the palm and fingers on a flat surface when laying their palms on a tabletop. When means person is placing his hand over the table, the hand will not be firmly touching with the table. That is tabletop sign. And both these signs are seen in diabetic chiroarthropathy. Then the next is Wardell's sign. Wardell's sign is to identify psychogenic or non-organic manifestation of pain. Okay, in this we see 5 signs. इसका mnemonic क्या है? Tiara said to drop a rose inoffensive. It is not that good. Remember as such only. That will be more easy. Tenderness, we see tenderness. Then we see simulation, distraction, regional and overreaction. Tenderness, simulation, distraction, regional and overreaction. 3 or more findings out of the 5 is considered positive sign for non-organic back pain. Means अगर इन 5 में से कोई भी 3 या 3 से ज़्यादा फाइंडिंग्स पॉजिटिव हैं तो हम कंसिडर करते हैं कि ये पेन ऑर्गेनिक वजह से नहीं हो रहा. इट इज़ ड्यू टू साइकोजेनिक कॉज, ड्यू टू heightened इमोशनल इफेक्ट्स. Okay, so this is Wardell sign. It is linked with the pain that is psychogenic or non-organic. The next is Popeye's sign. Popeye's sign is due to biceps long tendon rupture. When the biceps tendon is ruptured, then it will give this appearance that is known as Popeye's sign. Then next we have the slide of bone formation markers and bone resorption markers. In the bone formation markers, we have osteocalcin and bone specific alkaline phosphatase, carboxy terminal propeptide of type 1 collagen, amino terminal propeptide of type 1 collagen. Okay, then is in the bone resorption markers. In the bone telopeptide, here were propeptides which form the peptide, and here is telopeptides of collagen crosslinks, C telopeptide and N telopeptide. Okay, then here was alkaline phosphatase, and here is acid phosphatase, tartrate resistant acid phosphatase. Then another two markers are pyridinolines and deoxypyridinolines. Here is osteocalcin, means osteocalcin calcium बनाने वाला ऐसे we can remember. But here are pyridinolines and deoxypyridinolines. Okay, so that are bone formation and bone resorption markers. Then the next is fracture of necessity. Fracture of necessity we also studied in Salter's classification. So what is the mnemonic for fractures of necessity? Let's go for operation at medical college. Means we have to operate only in this. So L is for lateral condyle fracture, G is for Galeazzi's fracture, F femur neck, O olecranon, P patella. Then A is articular fracture involving the joint, and M is Monteggia. Galeazzi है, Monteggia. These upper limb fractures most important. Then is lateral condyle fracture, femur neck, patella olecranon, and articular fracture. So these are the fracture of necessity. Then next we have apophysitis and osteochondrosis sites. In this we need to remember the names linked with the specific region. Like if elbow apophysitis occurs, then it is known as little leaguer's elbow. If knee apophysitis occur, then it is known as Larsen-Johnson disease. And in the tibial tuberosity, it is known as Osgood shelter. In the tibial tuberosity हो रहा है तो Osgood. Okay. Osgood Schlatter disease. In the foot, Seaver disease. In the region of tendo Achilles. Remember like सीवर में किसी का फुट चला गया तो टेंडो एक्लीज इज सीवर्स डिजीज देन इज फुट ऑस्टियोकॉन्ड्रोसिस में क्या है नेविकुलर कॉलर बोन डिजीज नेविकुलर कुलर आ रहा है यहाँ पे कॉलर आ रहा है कुलर कॉलर बोन डिजीज एंड फ्राइबर्ग डिजीज डिस्टल फुट में आ गया देन इज इन द ल्यूनेट इन द हैंड वी हैव द कीन बॉक्स डिजीज ओके. Then in the hip we have the Legg-Calvé-Perthes disease, and in the elbow we have the Panner's disease. It was little leaguer's elbow. Apophysitis is little leaguer's elbow, while osteochondrosis is Panner's disease. Legg-Calvé-Perthes then is Larsen-Johnson, Osgood-Schlatter, Seaver's disease, Kohler's disease, Freiberg disease, and Kienbock's disease. Remember the names. Read it 2 to 3 times, then you will find it easy. Then the next we have the important angles. See, this one on the back of the foot is Bowler's angle. B for Bowler, B for back. Then is Gisanes. Gisanes is over the foot. Okay. Remember the images. Don't go into much detail. Cobb's angle is linked with the scoliosis. Okay. Then is Bowman's angle. Bowman's angle is linked with the supracondylar fracture. Carrying angle is also linked with the supracondylar fracture. Normally कितना होता है 5 to 15 degree. Excessive is valgus and decreased is gunstock deformity. Then is Q angle. Q angle is in relation to genu valgum or verum. Okay. And then there is amputations. In the amputations, the Lisfranc and the metatarsal amputation. Lisfranc is through the tarsometatarsal, and mid-tarsal. And Chopard's amputation is through talonavicular and calcaneocuboid joint. ओके, कल्केनियम के रीजन में कौन सी है? चोपार्ट्स. एंड बाकी नीचे मेटाटार्सल्स के रीजन में आ गई लिस्प फ्रैंक. चोपार्ट्स एंड लिस्प फ्रैंक इज मोस्ट important. Other names, if you don't remember, then it's okay. Chopard's is in the upper region of the foot, in the calcaneum region. And then Lis franx is in the region of tarsometatarsal joint. Okay. Next, we see the Dennis Brown three column concept of the spine. In the anterior column, we have anterior longitudinal ligament, anterior annulus, and anterior two-third of the vertebral body. In the middle column, we have posterior one-third, posterior annulus, and posterior longitudinal ligament. And in the posterior column, we have the posterior elements. Posterior elements what? Pedicels आ गए, lamina and spinous process. Pedicels, lamina and spinous process and posterior ligaments. Okay, this is Dennis Brown three column concept. So that are important images which I have discussed in the first part. The next one we will be discussing in the second part of the orthopedic images. If you find my content useful, please do like and subscribe my channel. Thank you.